everyone. My name is Sandy, and I'm going to talk about the newborn assessment with you. So when we do the newborn assessment, there's a couple of things that you'll do prior to walking into the room. You'll look at the chart and find out about the details of the birth, details of mom's history, and if baby had any trouble while it was being born. If you're in the room when the baby's born, you'll already know all of those things, and you can just go right ahead and assess baby. So the first thing we'll do, there are some things on the rubric that say, to check the bands and make sure that the bands match mom and baby band and things like that. So those are things that you'll do before you assess the baby. We're just going to talk strictly about the assessment. So the first thing we'll do is we're going to look at the baby. Okay, if baby's sleeping, we're not going to wake baby up immediately. We're going to look at how baby's breathing. Look for any sort of respiratory distress. Okay, so you would look for the nasal flaring. If you can see the chest without waking baby up, you can look for retractions and those kinds of things, grunting. And if baby's breathing fine, we'll just let baby go. We can count respirations while baby's sleeping. It's very hard to get respirations and heart rate and sounds when baby is crying. We can also lay a stethoscope on the baby's chest and listen to their heart rate at that time, so we can count that as well. After we do that, we'll have to wake baby up because we're going to take the baby's cap off. It's also very important to remember thermoregulation at this time. Keep baby as warm as you can. If you open up the blanket and let the baby be exposed, there's a chance the baby could get cold because they have a hard time keeping their temperature up or warm when they're first born. So we're going to keep them covered up as much as we can while we're doing this assessment. The first thing we're going to do is we're going to feel for the fontanelles. And while we're doing that, we're going to feel the bones of the skull as well. So the best way to do this, and the way baby likes it best, is to take your hand and run it over the baby's head. You'll feel the anterior fontanelle as you go. You'll feel the bones, the suture lines. Sometimes the bones overlap during birth, so you'll feel that overlapping. If this is a premature baby, sometimes the bones will be separated, and you'll be able to feel that as well. And then we'll feel the posterior fontanelle, and the palm of our hand should be on the baby's head at this point. And babies like that. They like to feel a firm hand on their head, okay? So we'll be able to feel all of those things. We'll also be able to look at the baby's head and see if they have what's called caput or cephalohematoma. With caput, you can remember it as a cap, okay? It's going to be swelling that's going to cover both sides of the suture line, okay, like a cap. With cephalohematoma, you'll just see a lump on one side or the other of the suture line. It won't cross the suture line. So those are things we're going to look for on the head. And then once we do all of that, we're going to replace the hat, okay? And always remember to keep gloves on. If you know the baby hasn't been bathed, you should always be wearing gloves, but if you're not sure, you should wear gloves, okay, just to keep yourself safe. Once we do that, we're going to look at the baby's eyes. We want to make sure that the eyes are symmetrical, okay, that they're in the right place. We're also going to look for drainage, any kind of infection. We want to make sure that the baby's eyes look as healthy as they can, okay? We're going to check for nasal flaring as well, and look at the baby's nose. Make sure that they can breathe out of both sides. So what we would do is occlude one side and see if they can breathe out of the other. And then we would do it on the other side as well. We're also going to look at the mouth. We can look for what's called circumoral cyanosis, which is a bluish tint around their mouth. Sometimes babies have that right after birth, and that's just a transition thing, but we don't want to see that, okay? So if you see it, just let the instructor know or the nurse know that it's there. At this time too, we will put on a glove and we will take our pinky and put it in baby's mouth. And what we're doing is looking for a cleft palate. Okay, so we'll run our finger in the mouth down the roof, and we're looking for a hole on the hard palate and the soft palate. When you do that, baby will usually start to suck. Okay, so then you can check the suck reflex while you're checking the palate. Okay, And then the other reflex that we're going to check at this time is called the rooting reflex. So what baby will do is they'll look for nourishment or food, and they'll turn their head towards a person. Okay, that's how they look for food. That's called rooting. So we want to see that they're doing that. Right? When they do that too, it's a good time to check their range of motion in their neck. All right? So you can do that. You can also rub the sides of the cheek, and when you do that, the baby will turn towards your finger. That's another way to check rooting reflex and also to check the range of motion in the neck. We can also look at the ears at this time. We want the ear, the top of the ear, to be in line with the outer canthus of the eye. Okay, that's a good placement for the ear. If we notice the ears are down lower than that, that's not a good placement for the ear, and it could indicate some sort of anomalies. It might not mean anything. We just have to wait and see, but we should look and make sure where the ears are. Okay, so that's about it for the head. Now we're going to go to the chest area. So we'll leave the hat on, and we'll leave baby's legs covered up, and we'll move on to the chest. We'll open up the little t-shirt, and we'll observe the chest first. Okay, we'll look at the nipple line. Sometimes babies have more than 2 nipples, so we want to make sure we know that. We want to make sure that the baby is pink, okay, and that there are no retractions. So we'll be looking at that on the chest. While we're doing this, we would actually take the t-shirt off. And we're going to do a couple of things here. First, we're going to check the pulses. Now, we're going to check the brachial pulses, which are up towards the axillary area, okay? And if you feel around in there, you'll be able to feel them. They're pretty strong most of the time. So we would do that. We'll also look at the arms and make sure that the baby has full range of motion, that they're moving both arms, okay, and they're not like guarding one. We're going to look at the hands. We're going to count fingers, make sure there's 5. We'll look at the palm, and we're looking for a simian crease, okay? That's a crease that goes straight across the palm. That's something we would note because that's abnormal. That's an abnormal finding. We're also going to make sure there's no webbing in between the fingers, okay? We want each finger to be able to move independently. We're going to look then for the grasping reflex or the palmar reflex. What we'll do is put our finger in the baby's palm, and the baby will close its hand around our finger, okay? So that's the palmar reflex. The other reflex we'll check at this point is called the Moro or the startle reflex. And basically all we have to do is pick up the baby's hands and drop them, and baby will startle, okay? That's a normal reflex that the baby should have at this time, all right? We also want to check to see the baby's tone. Is the baby flexed? Is the baby kind of floppy and just laying there, okay? Babies are supposed to be flexed, all right? So if they're not, that's another thing we want to note. While you're here, you'll listen to lung sounds, and you'll put your stethoscope in the same place as you would for an adult, back and forth, side to side, okay? Of course, you're going to listen to fewer places because baby is much smaller than an adult, but you'll listen laterally, okay? And we can listen on the back when we turn baby over. You're also going to do heart sounds at this time, and ape to man is exactly what you'll do, okay? And then you can use your bell, turn it over, and look for murmurs, just like you would do with an adult, all right? The other exam that we'll do while we're here is the abdominal examination. So we'll look at the umbilical cord, and if baby is brand new, sometimes you can see the vessels in the umbilical cord. If baby's been born for a little while, you may not be able to see them. But you do want to look and see, does that umbilical cord look okay? Is it red? Does it have any sort of odor? Does it have any drainage? Because those are indications that there's an infection, okay? When we listen to the sounds, the bowel sounds, we're going to do it exactly like you would for an adult in each of the 4 quadrants, okay? And we're just listening for bowel sounds. We don't need to palpate, all right? But we do want to look at the abdomen and see, is it symmetrical? Does it look like there might be a mass on one side or the other? All right, those are things that we would want to look at right away. And again, we're looking at skin. We want this baby to be pink, okay? We don't want any kind of bluish color. Sometimes hands and feet can be bluish in the beginning. That's called acrocyanosis. That's kind of normal and it's okay in the beginning. So we would want to check and make sure that if it's there and note it if it is. The other thing we want to do is look at the clavicles, okay? And what we're doing is we're looking for crepitus, which is that like Rice Krispie kind of feel. And we would look to make sure that the clavicles are okay. Once we do that, we can bundle baby back up and then we'll continue the exam. But what we'll do is cover the chest and we'll uncover the legs, right? Because we always want to keep the baby warm. All right, so now we're going to look into the diaper area. Depending on if this is a boy or a girl, what we want to do is look and make sure that all the anatomy is there. Now, if this is a premature baby, it makes sense that some of the anatomy may not be done growing yet, right? So depending on the age of the baby will determine what kind of anatomy you'll see. But with a little girl, you may see a little bit of blood in her diaper, and that's okay in the beginning. That's called pseudomenstruation, and it's mom's hormones, baby's just getting rid of them. So that's normal in the beginning. If it's a little boy, we're going to be looking for the urinary meatus being at the tip of the penis. Sometimes a child can have what's called epispadias or hypospadias, where the opening of the meatus is not at the tip of the penis. So we want to note that immediately too. And then we want to know, did the baby have a meconium stool yet, or hasn't it? Has it voided at all yet? So those are things that we're going to be looking into. Another thing we're going to do is looking at the folds of the skin on the legs, all right? We want to make sure that those folds are symmetrical, and we'll be looking at the gluteal folds as well, which are back here, okay? We want those to be symmetrical. If they are not, that could mean that there's a hip out of the joint, all right? And we want to know that right away as well. We also are going to check femoral pulses while we're here. These are a little harder to find, but if you feel around right up in the diaper area, a lot of times you'll find them pretty easily. And we want to compare both sides, just like with brachial, make sure they're both even. We want to make sure baby has symmetrical movements, full range of motion of the legs. We'll also look at the feet at this time, counting toes, make sure there's no webbing. And we'll look at the creases on the feet as well, all right? We'll check Babinski reflex while we're here, which means we'll run our finger up the foot and we should see the toes fan out, okay? The other thing we'll do is the plantar reflex, where we'll put our index finger under the toes and the toes will curl around that finger. So those are all things that we'll look at while we're looking at the baby's legs, okay? And then we'll turn the baby over. Your diaper. Turn baby over, and like I said, we looked at the folds already. Sometimes babies will have birthmarks. Here, some call the Mongolian spot. Okay, it looks kind of like a bruise, and that's something we would want to note. We also want to look here for a dimple or a tuft of skin. That could indicate that the baby has spina bifida, and that's something we need to know as well. So we'll chart all of those things. And we're also going to look at baby's spine at this time. We want to make sure that the spine is straight, and we can feel it and we can observe it, okay? So you'll be able to tell if it's not straight. The other thing that we're going to do at this time is look at the baby's neck, and we're going to look for what's called webbing, and that's just extra folds of skin on the neck, okay? And that's something else we're going to need to note in the charting. And if you haven't done it already, at this time you can listen to lung sounds on the baby's back. All right. I think that's it as far as the assessment goes. You would document those things. Plus, like I said, look at the rubric, because you're going to want to know, has the baby eaten? Is the baby eating okay? Is the baby voiding? And those kinds of things. And I think that's it. So good luck.